Speaking of through the door,
She kicked it in.
Yeah, she kicked in the door, no doubt. She's back in. Lynn Cowles from Foundation Communities, back with us for a third time, back in the ring to take another swing.
Yeah.
Lynn, good morning to you.
Good morning, y'all. Thank you so much. This is so much fun.
Thank
Lynn,
you very much.
Yeah.
Thank you very
I
much.
tell you, that first time she rang the doorbell. We have a doorbell here for everyone. If you didn't know, she rang the doorbell. I thought she was selling stuff. And then she put her foot in the door when I tried to shut it. Because I said no, and I tried to, but she put her foot in, and now we can't get rid of her. So you can't get rid of me. We can't get rid of Lynn.
Yeah.
But she's back.
It just keeps on. The hits just keep on coming.
Yes.
Oh, my goodness.
Lynn, I'm going to get sentimental as we start. This
Okay.
has been great having you on.
Thank you.
The
Yeah.
information that you have been giving us, the conversations we've been having, it has been beneficial in my circles. The listeners that have reached out to me and said, I learned a lot about that. I've had some seniors reach out to me and say that some of the things that they've heard and that we've gone over with you. So you're doing your thing, Lynn Cowles.
That's
you're doing Your thing.
fantastic. Thank you. Yeah,
Appreciate you.
it's a complicated world of healthcare, health access, and
Yes.
there's a lot of info. It's confusing. There's no educational system to get people kind of like tuned into this kind of stuff.
Yes.
So this is just such a great opportunity to get to hear from your listeners and share a little bit about what we do.
Yeah, it is. The healthcare system, I think, is crazy, period. Because, and we were talking about last time we were on, we were talking about co-pays and what it does and what it doesn't do.
Yes.
And and all kinds of stuff like that. So this is great information, and I hope our folks are getting together with it and vibing with it. And so let's.
So that's the teaser. Because some people may not have these 2 previous weeks, maybe they missed this.
Sure.
Shame on them. But they don't know what we're referring to. We're giving you the adulations. So for the people in the cheap sheets who missed out, snuck in the door, they're standing room only, like Jabari does. He rolls like that. Lynn. Don't ever go anywhere with him. He's a standing room only guy. All that money, but he doesn't do that. So Lynn, could you help those who may have missed kind of understand your background and the statements that you have made over these last couple weeks, and then we certainly would like to go into a couple more topics.
Yeah, definitely. So I'm here representing or sharing info about the Prosper Health Coverage Program, which is a program of Foundation Communities, Central Texas local nonprofit organization, helping community members get financially stable and be able to make the decisions that they want to make in their lives. Getting jobs, buying cars, having families, getting school degrees, like whatever people want to do, we want them to be able to do it successfully, happily, and healthily. And so our Prosper Health Coverage Program is kind of like tuned into that last component there, helping people be healthy, because we help folks navigate the very complicated world of health access that I was just talking about a few minutes ago. So we're a health navigator organization, navigating programs like Medicare, like Medicaid, like the Children's Health Insurance Program, like employer health insurance, like programs for uninsured people, short-term, you can go on and on and on with the different types of health programs that are out there. And so our Health Navigator organization has a year-round team of about 12 people that helps community members answer questions about where they can go to the doctor, how it can be affordable, how they can track their medical progress, their medication management, planned surgeries, all of those things that are hard to do by yourself, especially if you've never done them before, if you don't have the language necessarily to go into an office and say, is my anesthesiologist in network? Like, that's not something that most people know to ask before they have a surgery. And if you do, awesome. Then our navigators can be here to help kind of just like support you through those processes. But basically, we help folks access affordable health care. So whatever somebody's situation is, whether they are employed or not, whether they are an English speaker or not, whether they have a GED or a college degree or not, no matter what somebody's income level, education level, residence in Texas, regardless of any of those kind of like details, we're here to help people find affordable health care. And this is an important time right now because for people who don't have offers of health insurance from jobs or Medicare or Medicaid for young folks or older folks, for the most part, very few other people have access to a health plan that covers all the things that they might need, except for veterans. Veterans might have TRICARE, right?
Yeah.
But for the most part, anybody who doesn't have an employer health insurance plan or access to one of those public programs probably could come in and talk to one of our navigators and see if we can help them fill out an application for health insurance through the Federal Health Insurance Marketplace, which is how the IRS helps people pay for health insurance if they don't have an employer that's helping them pay for it. So the deadline for January 1st coverage for those applications at healthcare.gov is December 15th. It's this Friday. There's another month to help people get enrolled with February 1st start dates coming up. But that's part of the reason why I'm here, is not only to make sure that folks know that we have a health navigator program in Central Texas that can help anybody navigate very complex health systems, but also that this deadline is coming up. And that's an important deadline for folks to know if you're uninsured or what some people call underinsured right now, which just means that maybe you have a health plan, but it's too expensive, so you don't use it. So those kinds of questions are the ones that we help people answer.
I'm sure there are a lot of people that at some point that don't have health insurance and they want to get seen, they want to get something taken care of, but it may be one of those situations like either they're a little, they're afraid or they're not sure how to navigate that situation. It sounds like that's what you guys help them do.
Exactly. Yeah.
I came across some stats that I wanted to float some of these to you and get your reaction. And I think it does tie into our conversation. 28%. That's the proportion of U.S. adults who have 3 or more chronic conditions.
Yeah.
That's incredible.
Is that worldwide?
U.S. Just in the U.S.
Just the U.S. Wow.
Yeah. 5%. Proportion of the U.S. population that account for nearly half of all national health expenditures.
Wow.
Yeah. The whole time I'm like, man, when I see L to the C, we're gonna talk about this. We're
gonna talk about some numbers. Yeah.
2 times rate of emergency department utilization among people with Medicare and Medicaid coverage compared to those with Medicare only. Yeah. And then
gotcha. Okay.
Lastly, 4 times rate of average annual healthcare expenditures for people with complex needs compared with all U.S. adults. 4 times the rate of average annual health care expenditures for people with complex needs compared with all U.S. adults. And so just think about, there are people out there who are 4 times the average, and they don't even know. They're not getting checked out. That train is speeding down that track, and they know nothing about it. You might want to get going. Yeah. And I thought all of this were the reasons why it's important that you're here today. And previous weeks, getting choked up. It's been a great ride, but I wanted to talk about. There are some of our listeners, and hopefully we'll get some people call in 512-836-2887. I believe that there's a lot of hesitancy.
Oh yeah,
and I was hoping that maybe you could help some people because it's cultural. Yeah, it is cultural. And here's some of the reasons why. There should be a little bit of understanding, and there's medical mistrust among Black Americans. Yeah. I told Jabari off air today that your mom's 1975 status experience is not the experience here in 2023. I know right now, Lynn, that there has been improvements in communication, that there's increasing transparency, that their welcoming environments have been created, and that there have been significant improvements on access barriers that may have previously been there. Yeah. So from your side, your view, what have you seen? For those who have heard you maybe the last couple weeks, and they still have that medical mistrust. And they're like, I mean, I hear what she's saying, but I don't know. I'm not really all that interested. Yeah. What could you say to them? Because I think some of them may be holding on to some things that they've heard and haven't experienced themselves.
Sure. Well, the first thing that is really important to establish a kind of like shared understanding together with somebody who has that mistrust of the medical community is, I hear you, right? Like all of those experiences are real. They are like captured in statistics. Yeah. Like it is definitely true that health outcomes are worse for Black and African American people in the United States because of communication barriers, because of mistrust. And I don't even mean mistrust from people like towards their doctors, but from the medical community towards individual people who go in seeking care also. And this is it's historical, you know, I mean, like this goes, I mean, it goes back to Reconstruction. It goes back to like the 17th century, you know, like it's just like, it's a long and structural problem in the United States. And so the first thing is just like, you're right. Like all of those things that you've experienced are completely real. And over the course of the last 15 to 20 years, and longer than that, if you kind of like broaden out your sort of like understanding of what a medical community is, because Black and African American communities have been creating health systems that work for them for centuries. There are many healers, and there are many. We talked about, you know, grandma health access, yes. like the traditions and the longstanding knowledge that community members have to help their friends and family be healthy. So all of those things have been happening over the course of history, right? Yes. But in the last 15 to 20 years, as health communities have started recognizing, as public health communities really have started recognizing, the data that offices are trying to track that include things like, even though Black people don't have the high rates of cancer necessarily that other populations have, they're still oftentimes dying at higher rates when they get those conditions, right? And so like even though like there are some improvements in health systems, you still see these disparities enacting themselves in really tragic ways in people's everyday lives. And so we see the development using public health data, using expert analysis from advocates and community members at the level of the state government, the federal government, local programs. You see programs like community care, for instance. That's a local clinic network in the Central Texas area. It's a federally qualified health center. They treat people regardless of whether they have insurance or not. They opened up specifically the Black Men's Health Clinic to treat people who are not necessarily connected to the health system normally, who do have a lot of distrust. But so when people go into the Black Men's Health Clinic, they see people who have shared their experiences, have training and background in working with people who have that kind of distrust, right, towards the medical system, and can make people feel comfortable. And that's the main thing that our health system doesn't necessarily do very well, or it's one of the main things that our health system doesn't do very well, is it doesn't recognize the backgrounds that people bring with them to the doctor's office and say, I'm not treating this person right now just for this medical condition, but also for all of the things that they've experienced in their lives that may lead to a negative health outcome. So, and the state of Texas just recognized this year in 2023 what are called non-medical drivers of health. Other people call these social determinants of health, and these are components of people's lives like income, job security, access to good, healthy food, education level. These are all things that contribute. No joke, the science right now says that non-medical drivers of health contribute 80% of somebody's physical health and mental health. 80%. So like the doctor's office visit that you're going to only really affects, and statistically, 20% of your health. The rest of the things, access to food, access to income, access to good jobs, good education, all of those non-medical drivers of health are 80% influential towards somebody's actual health outcome. So when somebody goes into the doctor's office, then what the doctor's office needs to recognize is that people come in with all of these histories and all of these cultures and all of these contexts with them. And so going to a place that is specifically attuned to those backgrounds, to those cultures, to those contexts, it makes the office environment more appropriate or more apt to better serve people who go there.
Yes.
And who need that kind of healthcare. Yeah. And then other than that, also the state of Texas has recently authorized doulas to perform pregnancy and labor needs for people who would otherwise end up in a hospital. And oftentimes you see people from African American communities and non-white communities seeking out the services of doulas because going into a hospital to give labor, to have a baby, is traumatizing, sometimes scary, and sometimes it's triggering for people for bad past experiences that they had. So you can see things like this happening in our public health communities that are specifically designed to make sure that communities that have suffered these health disparities over the course of hundreds of years. Try to bring those folks into the medical community, but on their own terms, right? Like on terms that make sense for people and that make them feel comfortable and welcome in those medical spaces.
We did get a call.
I think we got a call. Hey, good morning, caller.
Good morning.
Good morning. How you doing?
Blessed and highly favored. And yourself?
I'm doing wonderful. We all doing good up here. All doing good. Do you have a question for Lynn Cowles?
Yes. First of all, enjoying the information, and there's a couple of tidbits in there that I'm going to pursue that I wasn't aware of.
Mm-hmm.
I'd like on this observation is perspective.
Okay.
Diagnosed.
One more time. You cut it. Can you say it again? One more time. You cut out.
Okay. I'd like your opinion about this perspective.
Mm-hmm.
I was diagnosed type 2 diabetic 5 or 6 years ago. When I went to my first appointment after I was diagnosed, by that time I had already ate up as much information as I could. And when I went in, my doctor was in fact impressed with the amount of information that I had procured
Mm-hmm.
about what and she said, I wish everybody took it as serious as you are.
Yeah.
So I think there's a lot of medical availability out there, and there's a lot of avenues for people to seek medical attention, be it chronic or daily things. But what of those that just don't take care of themselves?
You're saying, what about those who need to take care of themselves and don't?
Yes, just like you were addressing the cultural things that we, I'm Hispanic, the cultural things, diabetics being part of us, high blood pressure, and then we have other things that I see a big hesitance, people just don't take serious when they've been diagnosed with a medical condition. If I was diagnosed diabetic, I'm like, okay, I have to change my eating habits. I have to do this. I have to do that. If I'm not trying to die,
right?
I know I'm not running toward. And there seems to throw their hands up in the. Okay, it's a death sentence. Well, not really. Not if you. What are we doing? People out. Their attitude and our culture that we live a longer, better life.
Right.
Thoughts?
Yeah.
Okay.
Great. Thanks for calling in.
Thanks for your call, man. I think I'm sorry about your phone's cutting in and out, but we certainly appreciate you calling. Okay.
Yeah.
Thank you.
Thank you. It sounds like what he's asking is, if somebody gets diagnosed, and has an issue, and they kind of throw their hands up and say, well, I'm going to do whatever I want to do.
Yeah.
Or do we say, okay, well, now I have, this certain diagnosis, but, how do I change? Okay, the doctor said I need to do this. Where is the follow-up? Where is the plan?
Yeah.
Do I make my own plan to, change my eating habits, or where can I get that information?
Yeah.
I think that's kind of what he's asking.
Totally.
It sounds like it's what he's asking.
Yeah, and also I want to just be very cognizant and respectful of the caller also, who said that he did a lot of research before he went into his doctor's appointment, right? He was like, I went in with a lot of information, I educated myself as much as I could, and that doctors and medical staff tend to, yes, appreciate that. There is an openness that is helpful as well when people go into the doctor's office to be able to do things like start making plans with their doctors. So using the information that you get beforehand, maybe doing a little bit of reading about conditions that you might have recently been diagnosed with, yes, and then also working with doctors' offices to make those types of plans, which can include dietary changes, right? And I'm not a medical doctor, but dietary changes, exercise changes, maybe changes to living environments. But I also just want to make sure that if we think about that question, even just from a little bit of a different perspective, oftentimes when people get a diagnosis, they don't throw up their hands and say, I'm not going to take care of myself. They say, I have these other things to take care of too, right? Yeah. So they go, my health is important to me. Yes, I probably need to maybe change my diet or go see a doctor to get a medication about this condition that I have. But also, like, I have a kid who needs lunch for school and a job to get to at the same time. And so usually when people, like, sometimes we have this idea that people just like don't take care of themselves. But the reality is they're taking care of other stuff first.
Yeah.
Which isn't necessarily for their own physical health. Like the priority, but they're the person making their own priorities, right? So a doctor's not going to be able to come in and say like, okay, well, instead of going to work, like, let's look at what's in your refrigerator, right? Like, that's not possible for some folks. And so one thing that is very, very helpful is working with a team full of people. Sometimes that can be in a doctor's office itself. Sometimes it can be with your local health navigator who can help you write out lists of questions to ask to your doctor before you even get to that visit. But working with people to say, okay, if I don't have all the capacity right now, if I don't have all the funds in the world, or even the maybe you don't have health insurance and you're just kind of like trying to get on the steps to making a plan to dealing with the diagnosis, then the best thing that you can do is just like try to be as open as possible to the people who can help. And that's not always an easy thing to do. And I realize we have another caller, but so I think first of all, making a plan for success, talking to experts, and then just like being very clear with yourself about like the first thing that I need to do is medicate. The second thing that I need to do is make sure that I'm tracking that medication carefully. The third thing that I need to do is look at what's in my refrigerator, maybe develop an exercise plan, right? But just like digestible, easy steps along the way so that it doesn't seem like a huge thing that you have to tackle all at once.
Yeah.
Or a scary thing that you have to. Yeah. I can definitely relate to that. Good morning, caller. How you doing?
Good morning, Jahori and Douglas. And I forgot the young lady's name. What's her name?
Lynn Cowles.
Lynn Cowles. Good morning.
Good morning.
And yeah, you're saying some pretty powerful stuff there. But you know, that previous caller was stating that, you know, you can't afford the co-payment and the monthly payment, even if you just want to get the cheapest insurance it is, because your income is not there. I hear people crying listening to people crying. They don't have the insurance. I have to pay $400 premium every month, but yet my co-payment is $5,000, $2,000, and on up dollars. And I know that you stated yours is completely different. And make sure you give us that name and information.
Yeah.
But what is legislature, government? And what is the private insurers and the government insurers doing to where people don't have to worry about when that ailment comes, how can I go to a specialist?
Yeah.
How can I be? They tell you go to the general doctor's office and they tell you, well, okay, you need to see a specialist. Okay, well, how am I going to get to see a specialist? Well, you're going to have to find some community programs. You know, that takes time, and they're not out there. And then they only pay for such a specific amount.
Yeah.
Now, because we at the bottom of the food chain, are we supposed to be treated like misfits? No, not caring, but you got rich people who can afford to pay for this. So how do you how do you balance the playing field? How do you hold our elected officials accountable for government insurance, United States wide, where when you are middle-aged or senior citizen and up in age and disability, you don't have to worry about that.
Is there information that we can do with that? You have a good question, Ms. Charlene, for sure. But I think that's the information that you're asking. Do you have information on that, Lynn? How we can tackle that?
Yeah.
These people are working 2 and 3 jobs I got to have insurance. So I got to pay for this insurance. This is what I'm hearing.
Yeah, exactly.
Okay.
Well, that's a good question.
Okay, then that's all I wanted. If you could lay that out and tell us the name of your insurance company again and your phone number, because you did say you had a better plan than most of them do, because people are crying and they need help.
Right.
Yes, ma'am.
Okay.
Thank you, Ms.
To God be
Charlene.
the glory. Y'all be blessed.
Amen. Take care.
Too.
Thanks for calling.
Yeah. So there were so many important points that caller was making. One is, and this is like it's a frustrating thing to hear, but in response to the question about holding lawmakers accountable to our sometimes failing public health systems is vote, right? So
yeah.
And it's important because the laws that have seen the public health programs that we have right now that have dropped rates of uninsurance in the United States from around 20% to around 11% right now are laws. The Affordable Care Act that opened up health plans to people who don't have employer health insurance, that's a law. It's a law that takes taxpayer money and helps people pay for different kinds of health programs. So voting and contacting your representatives, as slow as that is always a really, really helpful way to hold lawmakers accountable to the realities of everyday life, which are, I can't afford to find a specialist, I don't have health insurance, I don't know what community programs I can use, right? So that's one thing. And we do have a couple of different web pages that I can send to y'all that we can link on various web pages. One of them is our website is foundcom.org. That is for foundation communities in general. Our health coverage program website that has helpful resources for people who are seeking out medical care is helpenroll.org. And on helpenroll.org, there are guides to different doctors that people can go to based on which plans they're into. There are guides to finding affordable dental care. There are questions to ask a mental health care provider before you go meet them for the first time, because that can be a scary meeting if you've never sought out a mental health care provider before.
Yes.
And ways to contact local representatives if you want to try to do some of that advocacy, not only for yourself, but for your community as well. So we can definitely connect people with those resources so they know who to call, who's their representative, and what they can say to say things like, our public health system isn't working for me. There's got to be a better option. What is it, right? Is it subsidized Medicare for all? Is it universal health care, right? So just getting people in touch with what those things mean. Second thing, which is really important that caller mentioned, is oftentimes people reach that moment where they're like, I need to see a doctor right now. What do I do? And what we do as navigators in Foundation Communities Prosper Health Coverage Program is we help people plan in advance. Because the time that you don't want to be finding a doctor and finding a specialist is when you're sick or when you're injured.
Yeah.
Those times, those are the heightened situations where you're likely going to have a negative experience because there's already a lot of stress there. There's already trauma connected to that moment. And so what you want to do is have a plan, and even just a little plan. The closest doctor's office to me that takes my insurance, or if you're uninsured, the closest doctor's office that I can go to that takes uninsured people is this one, right? Even just literally having the address and the phone number in your phone. Where's the local walk-in clinic? Navigators can help people do that. And so making a plan is the best thing that people can do to help them kind of avoid some of those traumatic moments, and at least know where they can go and know how much they're going to have to pay when they get there, to avoid the kind of sinking, surprising feelings of shock when people get a $300 bill for go to a walk-in clinic. Third thing and last thing that I'll say connected to this caller's really incredible and very helpful call is we in the Prosper Health Coverage Program at Foundation Communities, we are not an insurance company. We don't sell health insurance. We don't provide any kind of health plans, but we do connect people with the programs that can get them into health insurance plans. So we help people fill out applications. The Affordable Care Act that I mentioned earlier, the law that makes health insurance available for folks who don't have employer plans, that application is at healthcare.gov. It's 30 pages long. It's very confusing. And so what we do is we help people fill out the application, get connected to a chunk of financial help from the IRS if they qualify for it, and then get the IRS to send that financial help to a plan that works for them. So there are companies that we help connect people to, but we are not those companies themselves, which is just an important thing to know, because for that caller, when you call into our program, you get unbiased nonprofit help, not connected to the for-profit health insurance industry, although we do help people navigate that industry. So there are lots of plans available to folks in Central Texas from many different insurers, like Blue Cross Blue Shield, like Humana, like Oscar, there's lots of them out there. And we help people figure out which one is right for them and help get them connected to financial help from the IRS to drop the cost of seeing doctors so that you can see a specialist affordably.
What I really like is you refer to them as health navigators. Mm-hmm. I like that. I got a little buddy I don't want to say his name, Jabari. You said anesthesiologist earlier.
Yeah.
One, he can't even spell it. I think he texted me. I think he thinks
I don't know if I can spell it.
Anesthesiologist
Do you know how many
is what he
people
said.
can actually spell anesthesiologist?
But for someone like my little buddy who would go into this situation, hell no, nothing, and he's intimidated by that. Are you saying, Lynn Cowles, that you and those health navigators will take the time and give my little buddy, he's not the quickest, but they'll be patient with him, even if English isn't his first language? I think you even mentioned there may be some people that speak other languages. Ja говорю по-русски, но он не говорит по-русски. I said I speak Russian, but he doesn't speak Russian, so I can't help him. But like, if there's someone that maybe could help him. So, Lynn Cowles, are those health navigators? They're not going to use big words that my little buddy can't keep up with, and they're going to have the patience and understanding. I thought I heard you say that they have some cultural sensitivities. So these aren't, I'm not going to be walking in there and I'm not going to be talking to someone. Here's the joke. Someone named Melanie who doesn't even know who Tribe Called Quest is. and Melanie may not even be able to understand where I'm coming from,
right?
My background.
Yeah.
The previous caller. If I'm walking in there and I say that my favorite song is Suavemente by Elvis Crespo, this health navigator should be able to, if they can't understand, they can go get somebody, one or two people over that could maybe help.
Right.
That's what you get. What I'm saying.
I get what you're saying.
There's some opportunities with these health navigators. Is what I'm gathering from you.
Yes, absolutely. If somebody doesn't know your favorite song, we will listen to it together with you. Just to get that background.
I like it.
And I'll make sure that we add Tribe to our next team training. Just to make sure that everybody. Yeah.
Exactly.
But what you're saying is absolutely true. And the like even the word deductible that we talked about last week is a tricky one, right?
Yeah.
So sometimes instead of saying deductible to folks, you start with the bare basics. You say it's a chunk of money, right, that you have to put into a health plan before the health plan helps you start paying for things. So yes, lay terms are really important. Terms that people use every day are really important, just to make sure that folks, again, can kind of like find their footing in this world.
Yes.
And yesterday I was literally helping a person who has kids on Medicaid and had dentist appointments with their kids yesterday at 2 p.m. They had been the kids had been rescheduled like 3 times because every time this person went into the dentist with their kids' Medicaid for whatever, I think like a tooth extraction, they had to reschedule. So this person had to take off from work, get the kids out of school, take the kids to the dentist office, only to get to the dentist office and then realize they can't get it done because the dentist office didn't have the prior authorization from the Medicaid provider. So we called the Medicaid provider and we said, do you have the authorization? Give us a confirmation number. Then we called the dentist and we said, dentist, here's the confirmation number. And so we did all that linking that person didn't know how to do beforehand. So that is also the kind of work that we help folks do, in addition to just like getting connected to health plans, knowing how to use them, but that very specific, we call it patient advocacy. So being a patient advocate for somebody is sitting with them and making sure that they can navigate those complicated relationships effectively.
We had a caller, hopefully.
I think we still got
back in.
Good morning, caller. How you doing?
I'm kosher. How about y'all?
Hey,
good.
Smooth over here.
Yeah. You got a question?
Right. I got a. Yes, sir. Miss LC, can I call you that? If you don't mind?
Please.
That's right. I had a question and concern for us. Are you melanated?
No, I am not melanated.
Okay, I said that to say, like for an example, by me being melanated, and I had a doctor that have no melanin, no pineal gland, no type like carbon 10. Ain't that like automatically our cellular structures are different?
In terms of what how we deal with medicine in terms
of how my whole genetic makeup is as a being, as a deity.
Okay.
So I said that to say, I hear the talk that lies under the deceiving for as black folks is likely to have cancer before any other type of entity. I find it hard to believe because what it is it's the violation of the food.
By us being melanated, we got to have electricity foods. We got to have an alkaline diet. We don't supposed to go to the doctors and allow them to put our body in acid state, which is pills. You know, that doesn't do nothing for the body. So I said that to say electricity foods, meaning, for an example, I pick a watermelon with seeds over a pear. Or I pick grapes with seeds over an orange. Because those fruits have actual electromagnetic electricity, which is what we move off of for us being melanated with a pineal gland and our macular structure. Is different from any other deity. So I understand when you say we likely to die of cancer quicker, that's because we're different type deities before. That's just like if you got a reptilian versus a reptile. A reptilian is going to shapeshift. A reptile going to stay the same and evolve because it's a natural nature thing. So I say it all that to say, like, and you know, when you speak up on melanated folks, you know, I feel like we shouldn't get promoted to no doctors to get our body in acid state. Y'all should promote electricity foods because if you look at it, in 1988, it was Dr. Sebi against the Supreme Court. And he won his case. The same, he had his diagnostics in check, his feces coagulated, you know, on all diseases that was cured. Once you remove yourself from uric acid, lactic acid, antacid, you dig what I'm saying, in blood and starch.
What was the name of that case that you just mentioned?
It was Dr. Sebi, right?
It was Dr. Sebi. Yeah,
Okay.
he won went to the Supreme Court. It was United States of America versus him.
Okay.
And what he found out was we're different deities than any entity out here, to where our bodies and cellular structures is different from any type of entity. For as when it comes to food, that's the #1 violation, and mucus, to where when we eat all this blood and starch, which is meat, you know what I'm saying, chicken, you know what I'm saying, stuff that's diseased and stuff that's not natural versus greens versus a hybrid, which is broccoli, it doesn't do nothing for the body. For as if you melanated, that's a proven fact. So it's like when you state that we're likely to die more than any other race, you know, explain why, because we're a different deity than any other type of entity.
Hey, caller,
proven fact.
Appreciate
you. Know what I'm saying?
Yeah. We got that. We want to give her a chance. Thanks for calling in, and you gave us some great topics here. But we have to give her a chance to respond, and we do want to open up these lines for a couple others.
I've been listening. Yeah, she can respond to me. Go ahead and respond to me.
Yeah. Hey, thanks for calling in.
Thanks, brother.
So, Lynn, I think he misheard. I don't remember you saying that we were more likely to get cancer. I thought you said that our rates were lower. It's just that with the lack of attendance to healthcare systems, then we could have higher rates of our demise based on the fact that we didn't check it. Was that correct?
Yeah.
I think he misheard on that.
We still got to go to the doctor, period. I don't care what you eat.
I think he misheard that part. And then I believe, and again, I think you heard the call as I heard. But I do also believe that he's really talking a little more about that what we covered last week, that an herbalist versus what you said last week, and he may miss that, is you said we take it all.
Right.
Like you were a fan, and again, you are a representative of a foundation. You are not here giving medical advice.
Right.
But you said no. A person should use cultural remedies. What did I say? I said my grandmama hate it, but my little mama love it. Little mama wants me going to the doctor. Grandma said, no, we're going to do it this way. And you said, no, we're going to do that. And on top of that, still use some of the medical improvements that we have here in 2023. So I don't know. He did cover a lot.
Yeah.
Dr. Sebi, I looked it up. He was an herbalist, found not guilty in a fake healing case.
Gotcha.
And so that's who he was referring to.
Yeah. Well, and importantly, there was, thank you for that call also. The reality is very true that you mentioned that the medical industry does sometimes prescribe medications to people instead of lifestyle changes.
Yes.
And that is like a reality that the medical industry is trying to work on. And I realize that when I say trying to work on, that doesn't help necessarily. It doesn't help people right now. And so I'm just kind of like responding to multiple callers now at once, but like it is very important to do the very important work that you, caller, have already done, right? Which is like recognize your own health needs, that your own genetic makeup is different than everybody else's genetic makeup, and then that makes you a unique person in regards to the healthcare industry and in regards to your own health. So what works for somebody else is not necessarily going to work for you, and that's something that our medical offices and the medical our medical industry in general needs to recognize. Like, we don't have a one-size-fits-all approach for all things. And so it is important for people to take their family histories and their family traditions and merge those together with the plan that they make for their access to healthcare using our kind of like traditional methods through doctors' offices and hospital systems and urgent care centers. And that's specifically because you're not going to be able to solve all medical things with nutritional healing or with avoiding medications in service of a more natural route, right? And so if you fall and break an ankle, then you're going to probably end up in an urgent care, not in a nutritional healer's office for the most part.
Yeah.
And so again, just like finding the balance between these different types of knowledge, kind of like our medical industry and then our traditional and family and ancestral knowledge, the balance of those two things is really, really important, especially for community members that even have access to that type of knowledge. And so recognizing yourself as a unique spiritual being is absolutely an important component of the path to healthcare.
Yeah.
And so I really want to celebrate that caller for recognizing his own genetic uniqueness and also finding his own way to try to avoid the pitfalls of the American medical system as he sees them. I
appreciate your response, and that goes to that call. I feel like was a piggyback onto what I was just saying when I was making fun of my little buddy. Mm-hmm. Just that there are people that may think, okay, 3 weeks, L to the C. He picked up on it.
He did.
But L to the C is after listening to her, like, she's changing my mindset. Mm-hmm. And now I would like to maybe extend myself. But then this caller was getting to that point where I felt like he was saying, some people may feel like I don't have options. Like, it's just one size fits all, or I go in and it's like, you do this and only this. But your answer to him, it sounded like you're saying, there are flexibilities. Mm-hmm. We're not stuck. There are. If your health navigators send me to a doctor and I don't feel like I'm getting where I do, I could come right back to your navigators and be like, "Hey, I appreciate y'all helping me with wherever situation." And I'm really just making a really broad. I hope I'm not too wrong with this example.
No.
I could come back and be like, "Man, I appreciate y'all helping me. I was going down this path with this doctor, but I feel like I need to get away from that doctor." Like, you can switch.
Oh yeah.
You're in control. It's your healthcare plan.
Exactly. Right. And that is such a good point, Douglas, because people can, depending on what kind of health plan people have, some can choose a new primary care doctor every time they go to the doctor. Some can only switch every month. But
if I need to.
Yeah, right. And if you're in a plan where you can only switch every month, then we can help folks figure out what the kind of like the best kinds of research tools that you can do and phone calls that we can make with you or that you can make on your own to get to know a doctor before you end up in the office, so that you can hopefully like learn a little bit about your the style of communication that you'll have with that person in advance. And yes, we 100% work with people multiple times throughout the year. Folks will come in, they'll get help with an application, they'll get into a health plan, and then they'll come back to us and they'll say like, how much should my medication cost? Like, I don't really know how to use this list and then this other thing over here, like, to help me figure out how much it should cost. And then also, like, the truth, doctors' offices make mistakes sometimes. They'll bill an insurance company for the wrong procedure, and they're like, not in bad faith or anything, just like mistakes happen. And so people will get billed, $100 for a physical therapy appointment when they should have only paid $10. And so what we do is we help people connect with the documents that their plan gives them and the office themselves, and we'll call offices with our clients who that office calls a patient and say, this is how much it should cost for this procedure, right? And this, sometimes health insurance companies miss whole memos from our public health systems. And so there are health insurance companies who sometimes will just like mistakenly not recognize that if somebody goes for a mental health care appointment, it should cost what primary care costs.
Yeah.
So if you're going to go see a primary care doctor and your copay is $5, if you go see a mental health care professional for therapy, it should be $5. It shouldn't be $10 for your specialist copay because for mental health care, a mental health care professional who's not a psychiatrist is a primary care doctor. And so we've had to help health insurance companies come to those realizations over time so that they're charging not only that one person who we identified that problem with, but their entire patient base or their entire enrolled person base to make sure that they're doing right by all the people who are connected to those plans. So the things that we learn from our clients really help us not only improve their own health experience, but the health experience for the entire community also. So those meetings that you're talking about with people are just like so important for us as we help improve health systems for everybody, and especially for people who've felt marginalized by health systems in the past.
I just want to finish up. Last week, you said that other people may not be as eloquent. They may not be El Boogie, but her and her team, they are willing to project themselves. Mm-hmm. They are willing to come to community centers, mm-hmm. to maybe not every church, but some church opportunities. I mean, get in, shoot your shot, get them before they're booked up. Who knows? They may come down to Mount Tabernacle over on 23rd Street. Y'all might get them, but you gotta get them. If Sister Jenkins is taking too long to reach out to Sister Cowles up here, then that's Sister Jenkins' fault. That ain't Sister Cowles' fault. Right. And then because we have to break here. Yeah. Could you just maybe give us a summation of, again, why you came here, mm-hmm. some deadlines that we have before we go out, just so people can have a quick recap before we call this quits.
Yeah. Thank you so much, Douglas. Thank you so much, Jabari. This has been so
great.
good. Yeah.
You are welcome.
So the deadline for enrollment into health plans for people who don't have employer health insurance is this coming Friday, December 15th. So there's some wiggle room there sometimes, but in general, if people need a health plan that's going to start on January 1st, they've got to enroll by December 15th to do it. So the Prosper Health Coverage Program from Foundation Communities is available. You don't have to make an appointment. You can walk into one of our Prosper centers. There's one in North Austin. There's one in South Austin. You can call in for an appointment. We do appointments over the phone. We want to help as many people as possible across Texas have access to good, affordable health plans for the 2024 year, and then also throughout the year to help people use those plans. So in order to get in touch with us, you can dial us at 512-381-4520. You can visit our website, prosperhealthcoverage.org. You can go to the Foundation Communities website and navigate to us. And most importantly, we just want to get in touch with all people who are uninsured or underinsured. If going to the doctor is too expensive for you, give us a call. We can help figure out with all your different life things, who you work for, what your income is, where you're located, what your family size is. All those different things play into how applications work for people. And we just want to help people figure out what the most affordable way for them to seek out medical care that works for them is. So let us help you make a plan for a healthy 2024. And thank you all so much again for sharing our info.
Thank you, Lynn. We certainly appreciate it. And website is foundcom.org. I know we use com and org for websites, but it's actually foundcom as in Foundation Communities. Foundcom.org is the website, correct? Mm-hmm. Awesome. Yeah. Very good. Lynn Cowles, been great to have you.
Yeah.
Look forward to having you back another time.
Sounds good.
Thank you.